So this child has got a type of skin condition known as papular urticaria. So papular urticaria is a skin condition which is especially seen in people who have got atopic dermatitis. Atopic dermatitis is a skin condition which is there from the early ages, but it tends to manifest at different stages of life. In people who have got atopic dermatitis, they would be more prone to mosquito bite allergies, and which is known as papular urticaria, which is what we are seeing in this particular child. It's happening especially on the open areas of the skin. It tends to happen especially during summers, and we just have to go into a history of similar lesions in the family, or we have to go into the history of family members having asthma, allergic rhinitis, and skin conditions. So goes off on its own, but just the patient needs to be told about the do's and don'ts and the wearing of full sleeves clothing and some mosquito repellent creams. So it's easily treatable. And the sufferings would be he will keep on scratching and he won't be able to concentrate, especially on his studies or for his playing and things. Plus it's been leaving behind scars on the skin, which he might not be able to appreciate at this time, but at a later age group the scars look unsightly.
क्या तकलीफ है?
दीदी सिर में बाल नहीं है।
अरे सर में तो है बाल।
दीदी थोड़े से
बैठो, बैठ के दिखाओ कहाँ नहीं है। अच्छा
दीदी
चलो देखते हैं। छोड़ो खुद छोड़ो। नहीं है ये यहाँ था कहाँ था? This infection called pediculosis, and we will treat it, and she'll be all right in 10 days time, I think. She's complaining of itching only,
Right.
and followed by itching she'll do an excoriation of the skin, and that can lead to pain. It is there, infection is there that is causing itching, so we need to treat the infection. Treatment would be in the form of shampoo and one tablet and lotion, and that will take care of this problem even in I think in 7 days time.
2-3 साल से है, 2-3 साल से। हमारा नाम माया है, इसका नाम पलक है।
डॉक्टर चीना सेंडेट, डॉक्टर मनीषा के पेशेंट हैं।
Itchy rash in the hands.
हाथ में पूरे शरीर में ऐसे हो पैर में सब बहुत खटखटाता है। दाना निकल दबाओ तो पानी निकलता है।
What's the case about?
Right. The case is basically, obviously, initially with mum, with a very itchy rash, which is, she describes as actually everywhere, but worse on her backs of her hands, and also to some degree on the feet as well. And the interesting part about this is that obviously you can see that the daughter has exactly the same thing as well. And so that just makes you then think, is this something like an infection of some sort? it's a very unusual, very interesting form of manifestation. It's not something that commonly shows up like this, and so I'm just really now going to just look at other parts of the body where I might get more sort of evidence to support that diagnosis. Sure. Because I'm thinking about a skin infection, so what we've done is we've just done a very simple test called a skin scraping. So it's just a scraping of the skin, and that is now going to go to the laboratory, and we're going to have a look to see whether there's any evidence of any infection in that skin. The interesting part about this case is that mother and daughter have got the very similar features. So I'm just trying to make sense of the diagnosis here.
Actually, on a daily practice, we get a lot of skin patients, and most of them, since we don't have a skin specialist, a resident skin specialist, don't have a proper diagnosis. So we felt that there's a need to have a few skin specialists here so that we have a proper diagnosis, and further we can follow up the patients. Common skin problems, sometimes we have cases that keep recurring. The problems don't go away at once. So all of us, the resident physicians here also get an exposure on how to manage common skin problems and the difficulties we face while treating patients. So it is very good that we have specialists from, I think, all over the world now. We have from different regions. We have a person from New Zealand, we have a specialist from Jammu and Delhi. So they all give us different ideas and better options. Around 600 to 700 patients. We already had 320 plus yesterday, and till now it's 10 a.m. and we've registered 150 patients till now.
कैसे हुआ?
ये बचपन में रही कूद कर बैठे रही।
अच्छा, जल गया ना? और ये कब से है?
ये हमारे से कल गए ड्यूटी से तो बहुत रही, तो कल देखे तो हम बोले चला कल आएंगे, देखिए दवाई कराओ या
अरे इतना कुछ है, दिखाओ क्या है, इधर रखो। मुझे लगा कि ये तो अच्छी खासी एब्सेस, ये तो एब्सेस है, ऐसे वाला ट्यूबरकुलोसिस की तरह भी प्रेजेंट करता है, लेकिन ज़्यादातर वो ड्रेनिंग में चला जाता है, और इस तरह यहाँ नहीं आएगा, वो फिर सब यहीं पे आएगा. सो इट स्टार्ट विद एंटीबायोटिक्स, एंड सेकंड को वापस दिखा सकते हैं ना, 2 तारीख को वापस दिखा सकते हैं इसको, ठीक है. तो इसका अभी क्रीम देते हैं, थोड़ा सा ठीक होगा, लेकिन अंदर से चमड़ी खत्म हो गई. जैसे ऊपर तो एक लेयर रह गया ना, अंदर वाला सब खत्म हो गया, वो जल गया है ना. तो जब क्रीम भी देंगे तो आहिस्ता आहिस्ता ठीक करेगा इसको, ठीक है. और हो सकता है बाद में हम कुछ और करके इसको ठीक करें, ठीक है. तो अभी क्रीम देना जरूरी है ताकि और खराब ना हो, और थोड़ा पहले से ठीक हो जाए, ठीक है. आई थिंक this camp would be going to help each and everyone, like Satsangi or the patient, a lot in future, today and in future also, because we are seeing so many patients with so many different type of skin problems, and most likely what I think, the people will get benefit within 3-4 days, and hope may arrange such type of camps in the future also for the benefit of our patient. I think it's everyone's personal experience. You get the ways he has blessed each and every one of us, and it is just him who has given us, all of us, power to be here for the camp and all the activities. That's what I can share with you.
It's a huge benefit for all these patients. They've been coming from all these distant places. They don't have good facilities, and many of these are farmers and laborers, and there are certain skin conditions which are very unique to these people. So coming to the camp, we can explain those things to them. They're allergic to a number of things. Some hygiene levels are not good, and what to use, what not to use, what to avoid. These things can be told to them. The medicines are all being given free. So I think it's a huge benefit for all these people. So, of course, goes without saying that he has set up such institutes which are one of its kind. These are 100% free hospitals, and the beauty of these hospitals is that they are at places where the normal health services are not so easily available. So he made it a point to especially make this hospital at these distant places, like especially Barsana, like Mangadh, where people do not have access to specialized care. So that was one. And number two, these hospitals being 100% free with the latest technology, the best of the doctors. So this is something which of course drew me to give my time and come and do these services for Maharaji.
This is all part of Sri Maharaji's grace to be here, to be able to do my service, my seva, with the skill that I've been given, and to be able to help the people, as you say, the impoverished people who wouldn't otherwise get this opportunity here. So it's hard to describe in words, and it's all really Sri Maharaji's grace that I'm here. Yes, we actually took, as you know, took some skin scrapings from both the mother and the daughter, and interestingly, both were confirmed as a fungal infection, which is actually very satisfying to have confirmed the diagnosis, and it's also meant that we can then make a start for both of them with treatment within a course of some oral antifungal medication, and all going to plan in about 4 to 6 weeks. The rash will have settled and cleared away completely. A lot of during this camp, I am seeing quite a lot of fungus infection, and it probably is related to living conditions. It's also related to contact with soil, the animals in close proximity. So it's a combination of all those things, but certainly living in conditions which sometimes not so hygienic can contribute significantly to fungal infections. I think they all going to plan, and as long as they complete their course of medications, I think both will do very well. This is the great thing with Sri Maharaji's grace. All the medications that are dispensed here are completely free, which takes away that tension or stress from the patients that come to the hospital here.